the current situation in Montreal is not really what we were planning or expecting 2 weeks before Christmas. And I think it commands us to be more agile and resilient facing the Omicron situation. What we're seeing right now is a rapid increase in the number of the incidence rate or the number of new cases in Montreal in the last for the past few days. We had yesterday more than 844 new cases, and we're expecting in the next days that this will continue to increase. We have a high rate of screening tests, and our positivity rates are increasing. Right now, we're around 8% of cases that are tested that are positive. So we're facing a double situation. We have on the one side the Delta variant, the wave that is amplified by outbreaks in schools, and we're seeing a high increased number of cases. The incidence rates are really high in the 5-11 years old group, the 35-44 years old group that are their parents, and of course with those outbreaks it's going in workplace setting, and it's touching other group age in this wave right now. And on the other side, we have the rapid progression of the Omicron variant, and I'm going to give you some numbers right away. But before that, I just want to say that with mainly this Delta wave, we have seen in the last 7 days 5 deaths and a small increase in our new hospitalization rates and people gaining in intensive care unit, with 49 new hospitalization and 16 new admissions in intensive care units. So if we're looking more at the Omicron situation in Montreal, we have the chance to do criblage or laboratory testing to identify this variant in one of our laboratories. And we have currently 95 cases of infection associated with the Omicron variant. Most of our cases, the age is the median age is around 32 years old. 90% of those cases are people that have had 2 doses of vaccine. 80% have symptoms, but we do not have any hospitalization or deaths associated with Omicron variant. But we know that right now it is mainly in young age populations, so it is still uncertain what will happen if Omicron variant is introduced, for example, in places where we have elder population. When we look at 50% of our Omicron cases are imported cases from traveling, mainly USA, Europe, 5 cases in Europe and 5 cases from Africa. And the other cases are home contacts, or linked to outbreaks in different settings. So we have 1 community centers that is touched, 2 primary school, 2 university, 1 daycare center, 1 gym, and 1 sports team. So what our main goal right now, we have 2 main goals right now. The first one is to delay the time when Omicron is going to take the place of the Delta variant. So we see all the measures that are put in place for travelers, but also our suppressive approach that is mainly addressing this goal. We also want to make sure that the increase in the number of cases is not as rapid and as high, so we try to delay, but at the same time to make sure it is not happening at the same time so that the increase in hospitalization exceed the capacity of our healthcare system, and this will and for this, we will need to put populational measures and reduce our contacts. And the other goal is mainly to protect a vulnerable population, and that is why we're asking people to get their third dose if it's indicated as soon as possible. Healthcare workers, people with chronic diseases, pregnant women, and elders 70 years old and older. We still have the appointments that we have right now are for you, and we're asking rapidly that those groups get their third shot. And of course, we will increase measures in healthcare setting and elder residency to make sure that we protect those populations from the Omicron variant. So I think facing Christmas time, I think we have to. We recommend that the population reduce its contact before Christmas, and we'll see if the recommendation for Christmas are going to be the same. But at the time we're speaking, I think we have to reduce our contacts, reduce parties at the end of school or in the workplace. We also ask people to get their third shot, and I do encourage also parents of youth that have youth between 5 to 11 years old to go and get their youth vaccinated, because in Montreal we are still at 40%, so I think we can do better. And of course, screening if you have symptoms or you are in contact with a case. We will never say it enough. Basic measures do work. So distanciation, wear your mask if you're indoor, and of course ventilation and washing your hands can be helpful. At this time, at the time we're speaking, we still have uncertainty with the knowledge we have on Omicron variant, so we still have to be vigilant. I know it's not good news, so for some person it's a feeling of déjà vu that is not a good feeling, and some person may feel anxious. So I do ask the population to be aware around you, of people around you, asking them how they feel about the situation, and if people do have anxiety or other need, do not hesitate to consultate or to get help. It is quite a difficult period for us, for the healthcare system, but also for all the population. We do understand. So as soon as we have more information, of course, on the measures that are going to be put in place or on the progression of the variants, I will be there to announce them. Thank you.